explain sumo conventional here in a second. So keep your feet there, but stand back up. Now, just kind of walk through what you do. So she's setting her feet, and think through, like, are you bracing in this point? Are you not worried about it? Are you then getting your grip, bracing, pushing the slack out of the system, and then going? Like, just kind of walk through it like that. I have no idea what you're going to say, but.
Yeah, so how I'm thinking about it is I'm lining up my shins on the bar where I want them. I'm hinging back, making sure not to squat forward. I'm bringing down my arms so they can get out of the way of my lats. And I'm bracing a little bit as I come down to the bar, but I don't really turn my brace on until I start to pull the slack out of the bar, and I kind of do that. Maybe this is wrong.
Yep.
All kind of at the same time as I'm trying to lengthen upwards with my shoulders, my upper back, and my cervical spine, while contracting here and then making my hamstrings as long as possible, while also pushing my knees out.
Long story short, she's trying to get tension. She wants to get as much tension in the system before she lifts it up. So she had a little bit of a posture brace, right, where she's just sort of like getting into position, I don't know, was it 10%, 20%? It's not a lot. And she's just kind of bracing there. Then she sort of gets set, she's nice and calm, she's grabbing her grip, and then for her, she's pressurizing and getting tension at the same time. Totally fine. I break it up as pressurize, initiate, execute for people that don't do this all the time. And you want to break it up slowly so that they can clearly delineate between phases so that they are able to have pressure present. Now, have you had a DNS class before?
I got PT from a DNS session.
Okay, cool. When you're bracing, are you doing pressurizing stuff, or are you just kind of cranking back on?
Tracing.
Okay, cool. So she's already kind of learned how to do this. A lot of them, I've actually had Olympic weightlifting Olympians that did not know how to pressurize. And this chick can squat over 600 pounds, which is crazy. But she's already learned from someone how to pressurize. So now we'll get nitpicky with the back and kind of what we're doing, but she's already starting at a good point. Now, just for funsies, she is in, for those of you that aren't meatheads, she is in a sumo position, which is not a real deadlift. No, this is a joke in the strength training. I actually think it's a good lift, but it's so funny. Like in the powerlifting world, some people think it's like not a real thing, even though I think it's a great lift. Well, I teach a sumo, so I think it's great. She's in more of what I would consider a traditional stance sumo, and that is a sumo is any time that your feet or knees are outside of your hands. Okay. So go ahead and just do like 2 or 3 reps. Don't overthink it here. She's getting set, and then she's going to go ahead, tighten up, and then she's kind of standing up there. So while she's doing this, there's a couple things that are good about the sumo deadlift. One is that by widening her feet, you're good. What does that do to her center of mass? Lowers it. It's microscopic, but we're geeks here. By bringing her hands in, what does that do to her shoulders? It raises them, narrows them too, but it also, if I'm all the way out in a snatch, I'm here. If I bring my arms in, you can see that. What does that do to the spine? More upright. What position is better for loading through gravity? A horizontal spine or a vertical spine? Vertical, right? So she can't get vertical because she has the barbell there. Now the other advantage to moving the feet out, if she does a conventional, because you said conventional, feet are more narrow, hands are on the outside, okay? Now she's there, it just feels awful, I think, but she's gonna tension up here, and then she'll try to do all the same things and sort of sit back, so back down there. So now, chill just like that. You guys can't see from over there, but if you, yeah. Yes? Give me the shortest one, please. This is hard to explain. Okay, so.
Great, Rachel. Good job, girl.
Roll with me here. This is the best, this is a shitty, but this is the best explanation I can do to show two-dimensional representation of a three-dimensional object. Okay, now, if she is deadlifting, what is going to dictate how flat her spine is? There's a couple things. Let's just talk through it.
Diaphragm.
No, good. I like the style, but no. Hips can be one a little bit, so think bigger picture. Length of the arms is going to be one. The shorter the arms, the closer she is to the barbell, the flatter it is. Right? The other one would be the length of the torso. Right? The longer the torso, the more vertical she can be. The shorter the torso, the more flat she has to be. What's the other one? Femur length. Tibia, sure, but it's really femur length. Because what does the femur do, if you get set real quick, what is the femur doing to her center of mass in this position? It's pushing her center of mass backwards, okay? Good, let it go, stand up. So, if we're here, her femur length, let's say that this is her pelvis, this is her knee, the femur length is set. It is the restriction in the sagittal plane that cannot be improved or changed. You can change your dorsiflexion, you can change your hip flexion, you cannot change the length of your femur, right? So, if she's here like this, and she gets set, and she wants to have a more vertical spine, so go ahead and sit down, she's restricted by how far she can push her knees forward by the barbell. Okay, you can stand up. Make sense? If there's no barbell there, she can push her knees forward. Let's say that this is her center of mass. So in this case, her center of mass, her butt's way backwards, she's got to lean way forwards like this. And if she pushes her knees forward, now she can have her spine more vertical. Does that make sense? Okay? So that's in a conventional standpoint. Now here's a hard one. Everybody close your eyes. Close one eye. If you were to measure the distance, this is a two-dimensional thing. So her femur here, how far back it's pushing her hips. In a conventional deadlift, it's going to be like this. If I sumo her, it moves her pelvis closer to the barbell, which allows her torso to be more upright. So the massive advantage with a sumo deadlift is that she can be vertical torso, more vertical torso for better force loading. The compromise that you're making here is she's putting her hips in a near end range abduction external rotation position, so she's going to adversely load the hips there. Okay? The advantage of the conventional deadlift is that the hips are in a better position, but the spine is in a way worse position. So even though, for your purist, the conventional deadlift is kind of the way to go and the sumo is sort of a cheat, I don't know why anybody does conventional. It makes no sense to me biomechanically. So once we work on how to get set for a max lift with her, we're going to work on a modified sumo, which I guess I'll just kind of demonstrate right here. So modified sumo, more narrow. Is that your squat stance?
No.
Yeah, do your squat stance and see if you can do it. Grab the barbell. That's probably going to be too tight, so you're going to have to be in the...
Okay.
You're going to go, sumo.
Okay, great.
So now she's too narrow because her elbows are going to hit her knees. So now she wants to basically have her knees just outside your forms. Good. So now in that position, she's there. And then go ahead. You can move your feet out a little bit if you want. It's all right. So now she's in a little bit, but now what we've done is she's getting some advantage from the spine position by doing the sumo, but she's also keeping the hips in a better position because it's more in that mid-range. Go ahead, stand up there. So for me, with a normal person, I'm teaching a modified sumo all the time. What's my main reason for that? If you're gonna go pick up a bag of sand, is anybody gonna do this and pick up a bag of sand? No. Is anybody gonna do this? Not unless you have to, like you're standing in a hole or something. Everyone's gonna walk up, go like this, and pick the bag of sand up. So it's more functional, but I actually think it's better from a performance standpoint because you're getting better spine positioning and better hip positioning. So it's kind of a little bit of both. It took Jess 4 months for it to feel normal and heavy weight. We had to do doubles and triples and like lower weight to tinker with it, but now she's all in on it. And so is her boyfriend, who's not quite as good as she is. But I actually think all powerlifters could do this. My great argument for this is arguably the best powerlifter ever in history, Ed Cohen, does that. So I think it's a great lift. We're going to workshop that in a second. But that kind of completes my quick analysis, or just showing some people sumo, conventional, and then what I call a modified sumo. Does anyone have any questions about those? Good. And then back down. More pressurized. Good. Yeah, she's actually doing a terrific, so back down. So what I was kind of hoping for, turn 90 degrees to your right, or left, or whatever it was. I was hoping that she was going to like overuse her back muscles a little bit. She's got, you know, more on the right than the left and blah, 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 but she's pressurizing really well into her lower pelvis, and what I like about it, which is true at 135, that may not be true at, you know, 395 or whatever, she's able to match any extension producing force from her posterior chain within the resistance of the intra-abdominal pressure. She's pressurizing really, really well and holding that and not going into extension, okay? So we're not gonna do it today, but if we just kept loading the weight up, at some point she's either going to extend, that's a compensation for an inability to meet the demands of that position, or she's just gonna not compensate and go into flexion. Okay, we don't like that one for sure. And if she's in a meet, I definitely want her to extend before I want her to just lose into the flexion. Do you care if we just put like 185 on and then you'll face this way? Cool. Can you guys grab 25s for me? You can see she's got a little bit more erector tone on this side. So go ahead, back down, do your thing. She does a terrific job. She's gonna pressurize here, and then as she comes off the ground, go ahead, on your own, girl. And she stands up, what I'm feeling, so back down, just rest for a second. I'm seeing her pressurize while she's getting set, and she's not losing that pressure when she pulls. A lot of athletes, what they do is they'll pressurize great, and then the moment she starts to set, right? So that initiation phase, when she's sort of taking on the load or whatever, or pushing the slack out of the system, she then just loses the pressure and collapses into extension. And then a lot of times they're getting sharp facet-like pain pulling off the ground. So then for her, let's say that she was getting sharp extension pain pulling off the ground. Let's say we made this 375, and she's like, oh, it's right there. Well, then what we might do is drop her down to 355. I'm gonna send her home with singles every 3 minutes at that weight, where she can work on the functional capacity to stabilize well under that load. But what I want you guys to see that she's doing well is she's keeping really, really, really good pressure and stabilizing well even through the initiation of the pull phase. So let's just watch another one here. So she's good. Really, really good. So back down. So keep the feet there. Well, I'm going to talk through as you do it again. You guys all know she's in a ton of spinal flexion when she's getting set. Is that a problem? No, because then what she does is she pressurizes and she uprights into the position, but she has pressure there, so she's pressurizing before she cranks her extensors on. And so then she's able to mitigate any sort of compression or extension that the extensors would put on her by having the pressure present. So watch her walk through it again. She's grabbing it, she's in a little bit of flexion here, and then she's gonna go through, she's pressurizing, she's uprighting, and then she's pulling. Right there. She does it all kind of in one foul sweep.
Does that initial flexion,
225, okay?
does the initial flexion also help with her diaphragm to be able to pressurize properly?
It kind of depends. Can you guys grab some 45s for me? It kind of depends. It allows you, you know, cool. So one thing that it does do, if you have the diaphragm down, the opposite of open scissor position, is which direction is it going to push your abdominal contents? Down, but also backwards. So if you want to feel it into the back, having your spine in a little bit of flexion when you're setting up might make you feel the pressure on the spine first, and then you can sort of up right there. I don't know if she's doing that intentionally, but she might just be down there just trying to stay relaxed while she's doing it, but feeling that pressure pushing against her spine is really, really helpful, okay? And so maybe in that case it might. but we want her more uprighted. And what I was hoping she was going to be doing that she's not doing, is that she would lose the pressure. Even really good power lifters oftentimes lose the pressure. Now I can make her do it if we just keep going up. We're not going to do that today. But thank you. Yeah. Sorry, coach, I can't train. I did 40 singles in the deadlift. So go ahead. Let's go ahead and do it again. Let's face this way. I think I can see a little more that way. So if you kind of want, I get it. You're like, I prefer you don't. No, you're just doing great. Oh, no. Athletes don't move their we're not doing like CrossFit singles. You can take a little bit of a break. She's just doing a really good job. So that was 225. She'll go up to, we'll do 278, maybe 350. I'm not gonna go, no.
Whatever.
Oh yeah, I think she would, you would smoke 315, but she's doing a really, really good job. Now what I won't do is put her in a position where she might get hurt. But I was hoping to show you guys an example of functional capacity where if we go over, in this case it's load, or force production technically, the nervous system can't manage the co-activation there, and so then it resorts to a primitive stabilizing strategy, which is that open scissor position. Unfortunately, I think I'm outmatched here, and I think she's gonna pull 275 fine. What you will see is the spinal extensions will start to grip and they'll look like they're contracting harder, but I would bet $1 million she's still gonna be able to pressurize against it. But anyways, we'll just see. We'll go to like 480 and just see what happens. Yep. Don't do it wrong. Just make me look bad, because if you make me look bad, then your back stays nice and healthy, and you get to see a good example of. Now what you guys can't feel that she does really well is the intrapelvic pressure. She does a really good job of that. And intrapelvic pressure is what stabilizes the lower lumbar spine. So now back down. Now what do we see? She's losing flexion a little bit here. It's 275. This is decently heavy. Not in a position where we're like worried about it. She didn't worry about it. She might have even felt it, but she's starting to see a little bit of a bending force that's kind of winning through the thoracic side. So we might, are you okay with 315? And then we're done. 315, we're done. Don't feel pressure. Can you guys get another? You do. Oh yeah, all right. Wait a minute. You guys get a 45 for me? I mean, to be honest with you, if this ends up being an example of what's good, this is valuable. Cool. Any questions while we're letting her rest? As she's getting set, she's already got a little bit of a posture brace. She's getting set. She's going to get down there and grab the bar. She's getting her posture in position so she can brace correctly. She's then thinking pressurize, initiate, execute. There she goes. Pressurize, initiate, execute. Boom. Back down. Great. Really good. That was just a really, really good example. We're starting to get where she's losing in the thoracic spine, but you can have, in that case, that might be a performance insufficiency and not a strategy insufficiency. So for her, at some points, she cannot stiffen her spine against the load. It's not going to happen. And here, she was losing it, but then she corrected it quickly. And if we sat here at 315, I could get her to, or she could get herself to stiffen up fine here. But if we put the bar up to 375, 400 pounds, she's going to lose it a little bit. That's the fun thing about sports, that she can't stay in a perfect position. But I will say she's doing a fantastic job at, this is what, 75%, which she could probably pull for 5, I think. Not today.
I think I've done it for like 8 to 10.
8 to 10. Pretty cool, right?